a big thanks to Fast&Up, since the platform is doing really great when it comes to selecting and being very wisely making decisions about the ingredients, whatever these guys are providing you with the supplements, as I've tried them and tested them myself also. Being a functional medicine practitioner, I'm here to just make you guys aware of what initially we need to have in our macro and micronutrients. Now this is super important when it comes to our body, because we are lacking little of ingredients. These all are acting very important for our biochemical functions in our body. And when it comes to magnesium, it's very underrated, and definitely very less people understand the benefit of magnesium in the body, whether it's men, whether it's women. There is something that this magnesium is doing to our body. Now, when we talk about magnesium, magnesium is actually there in the body at 3,500 of binding sites. Now, when I say 3,500, it actually means that all the areas of your body is actually requiring magnesium in a very good amount. But what we usually do is we supplement ourselves with the very most commonly talked about vitamin D, calcium, and many more such supplements. But I've seen people very less talking about magnesium. So that's why we just picked up the topic as magnesium and curcumin, since it's something that's very less talked about. And definitely, I'm going to highlight certain points why we need magnesium and what is that one thing that's going to uplift all the areas of when we talk about biochemical reactions. Now, as you all know that some general conditions that we daily see: women with cramps, women with PMSing, athletes with a lot of muscle soreness, and definitely deficient with a lot of times we say that the person is deficient in vitamin D or calcium or probably any other calcium source. But the main fact out there is we need conversion enzymes. Now, this conversion enzyme or cations or anions in the body, somewhere is the magnesium. Now, if you're lacking magnesium, you can definitely not, fasten up the absorption of calcium also and vitamin D3 also. So, if suppose today someone has just told you to take vitamin D supplements or probably omega 3 or you are lacking and dropping down the magnesium. So magnesium plays a very important role in the conversion of your vitamin D3 and calcium. So no point of taking so many supplements and not knowing what's the root cause out there. So people who have got issues like falling hair, acne issues, and definitely feeling too much of bloating, and even when it comes to heart contractions and relaxation, magnesium is super important. So you might be able to understand in so many areas of domain, magnesium is super important. Now, obviously, macro and micronutrients, definitely they are super important. But why we are talking about magnesium? Because it covers up the 360-degree angle of every biochemical reaction out there. Now, why we are actually deficient in magnesium, the reason behind this is that we are really not focusing on the magnesium rich food. We are not really focusing on natural stuff that's rich in magnesium. We are initially we're possibly talking about too much of vitamin D3 and calcium nowadays, but the conversion that comes is from the magnesium part. So people in today's time, I personally feel that we are in a generation where we are consuming too much of processed food, too much of sugar, too much of aerated drinks, and that's where the problem starts. See, you cannot say that I am going on a very maybe people are getting supplemented with fat diets, yo-yo diets nowadays. But what initially is happening because of these diets also, the when we fast, we need that the entire uh, box of ingredients for our body to survive or thrive at that point of time, and there we lack a lot of enzymes, and one of them also is magnesium out there. Now, there have been, I think I've been seeing people with ailments related to hormonal issues, with menopausal cramps, definitely, falling of too much of hair, heart attack issues, repairing very less repair of their muscle soreness than people with immunity issues after the COVID has striked up. So when it comes to depletion and replenish, we are on the depletion side more, and less of replenishing side is there. So make sure if you are deficient in magnesium, you're taking the processed food less. Please avoid the backdrop sound that is coming. I'll just possibly slow down here. So any kind of overconsumption of sugar, or probably phosphates, or probably any kind of people who are having aerated drinks, even coffee, even tea, that is going to decrease the absorption of essential micro and macronutrients, and you're going to fall in the trap of being deficient in magnesium, or probably vitamin D3 or calcium. Now even procalcitonin is something that's super important, and we play a very less focus on that. So I'm sure people who are really looking up to magnesium supplements, they can definitely try the Fast&Up supplement. Even I've tried the fizz one. You just have to drop one tab into the water, and that there you go, you filled with enough amount of electrolytes also, and it's really good, because at that very moment you can just pop up, and possibly the drink that you are going to take, you are sure of it that it's something that's going to benefit you. Now let me talk about something very I don't think so people are really focusing or paying attention to this. People who are very gym oriented, or probably any person who's going on a lot of possibly weight training, or athletes also, we are consuming protein powders in a very high amount nowadays. And what usually happens is, when we consume these protein powders, we are initially, obviously we are taking good amount of electrolytes also, we are taking good amount of amino acids also, we're taking rich amount of protein also, but one thing that we are not actually going for is the magnesium. These protein powders are rich in protein, but definitely they're deficient in magnesium. So there lies a pros and cons of protein powder also. People who have got nerve dysfunctions now, sometimes you might feel that you are having leg cramps at night, or possibly while you're driving you're having cramps, or possibly you suddenly start getting your body into a very stiff position, and the soreness of muscle starts. There you need to understand that you are deficient of either magnesium, calcium, or possibly vitamin D3, which most of the half of the India is already into nowadays. So a very simple tip that I can give out here is, people who've got leg cramps, if you really want to check upon that you have got magnesium deficiency, just place Epsom salt into a bucket, place your feet 10 to 15 minutes out there. If you feel you have been relaxed and your calf muscles have relaxed, trust me, that's your magnesium deficiency, because your Epsom salt is magnesium sulfate, and it's getting absorbed into your calf muscles, or maybe your legs, through the skin, and that's where it shows up. That's very important to know. But before doing all this, you need to understand that you need to go for certain tests, which are definitely vitamin D3, procalcitonin, your CBC count, and your blood tests that are very important. And with that, if it's under your range, you can go for some metal toxicity test also, which is happening in Delhi nowadays. And I have been also telling people to go with their metal toxicity, which tells you what amount of metals you are consuming in a higher rate and a lesser rate. So that's very important. With that, some important functions of magnesium could be, nowadays people with skin, people who are very conscious about their skin, they are really looking up to glutathione. Now glutathione is something that makes your skin really glow, gives your muscles and your cells a push, your immunity a proper boost. But without magnesium, let me tell you, you cannot convert the glutathione. Your magnesium actually produces glutathione. So guess what? We're doing everything, but we're not focusing on what is converting that enzyme or producing that hormone in our body. So that's one thing where obviously magnesium plays a very important role. And when it comes to magnesium, your cellular health, your DNA repair, your cell growth, your mitochondrial health, your glutathione functions, your skin, super important, super importantly plays a very important role. Sorry, I just got this fall. Yeah. So these are the things which we really need to take care of nowadays. And when it comes to I think we can talk also about a little bit of collateral damage which is being caused by excessive of medicines nowadays. Why is it happening? The reason behind this is that when a person actually gets into a situation of muscle cramps, or you can possibly say any kind of bone damage, or possibly PMSing, or anything which we all go through, we initially start taking prescription based painkillers, and these painkillers are really damaging your liver, which also decreases or possibly restricts the production of magnesium. So make sure you are not going on much of possibly these medicines which are usually pain relievers, because they really restrict your magnesium transport of amino acids to your muscle. Now if you're if it's not reaching out to your muscles, there's no point of taking it. Also, I would like to say that people who have been on liver diseases or any chemotherapy or any kind of heavy drug prescriptions, they really need to understand that magnesium is something that they really need to look up with the diuretics also. People who are possibly having high blood pressure also needs to show what is the sodium level, potassium levels, and the magnesium levels. So I think supplementing with calcium and vitamin D3 in India is very high, but when it comes to magnesium it's very low, because we hardly focus on what is the root cause and what's not letting it convert, and the active form of anything is not available in India. So this is one thing. Also talking about sugar, because in India the obesity, the diabetes, and the hypertensive patients are increasing day by day, and we really need to understand the correlation when we talk about the micronutrients and macronutrients. Sugar actually accelerates the secretion. It's what sugar actually does is it's just taking out all the magnesium while you excrete, right? And this is how the magnesium just goes from your kidneys. I know it's super complicated that I've been talking about, but these all are very important when we are initially, there's no point of taking prescription based medicines, any pain relievers. The reason behind this is we are just depleting the essential micronutrients and macronutrients, and this is not letting our body come at relax. Uh, Possibly involuntary, if your body if your legs have started getting muscle cramps, or late night it has started, so that's the sign where you need to possibly get yourself tested and start supplementing with the right amount of magnesium through even rich food. Now rich food means functional fruits. Functional fruits can also include your flax seeds, your sunflower seeds, and definitely there are so many things nowadays where you can get a really natural amount of supplement also, where I can possibly I would suggest everyone to take it from the rich foods rather than supplementing themselves. Now, because the daily allowance of I think magnesium is 4.5 mg per day, and if you're taking that much, um, it's really going to boost and make your intracellular cells really happy. Make sure if you're having brain fog, muscle cramps, too much of PMSing, hormonal issues are going high in your body, and girls have been taking OCPs also, the depletion of magnesium is really high. So I would recommend all the people to go with the obviously supplementing this one thing. Now if you've not been you possibly can try Fast&Up supplement, where obviously I've tried it. It's really good I can say that you can, if you are going out somewhere and you feel depleted, or if you feel less of energy, fatigued, you can just, pop up that one tablet into water and you can just pop it up. So that's one thing where I wanted to talk about. But there, for I think there is one major section also that I'm missing right now is people with edema and water retention. People who are really hypotensive, they definitely have a lot of pedal edema, that is swelling in the feet, and even these people need to take care of their magnesium levels really well. So I would suggest that the right amount of D3, right amount of magnesium, and right amount of calcium, these three things going in one balanced ratio could actually help a lot of it really helps the body to come back to a state of you can say a balanced state where you can sleep well, where you can eat well and you can really feel good. And until unless your body is not at a phase of relaxation, we are most of the times actually in you can say flight and fight mode, and that's where the problem starts. Most of the people ask me, how does the stress actually depletes all this? So if you're not sleeping well, or maybe if you're not you can say if you're not sleeping well, or if you're not getting the right environment to sleep, or possibly your sleep is hampered in any of the ways, your cortisol levels really go down. And when it happens, all the kind of cycle that we are having right now, it gets dysfunctioned. So make sure whenever you have less amount of cortisol, your body reacts really well. But if it's high on stress, that is your cortisol, you excrete the magnesium to a very high level. And when you excrete it out more, you are more deficient in magnesium. So make sure all these things are possibly very important when we talk about this one thing. And I hope this much amount of information really helps, because talking about I think this overrated of supplement. I think magnesium has been very least talked about, and when it comes to calcium and vitamin D3, we all are very much deficient. I see so many people coming up with vitamin D deficiency. Now, when you have got that vitamin D deficiency, you don't need to be scared. You just need to grasp some good amount of sunlight early morning, because we cannot make or make that much amount of C and D in our body. So the conversion is really less, but if you take it naturally, even your magnesium uplifts. So that's why we say even your circadian rhythm needs to be very much balanced. So today I am somewhere out and working, so that's why I just landed up here live, and I couldn't settle up while for doing a live session today. Make sure you are taking out these tips from Fast&Up, because I have collateralated a lot of things when we talk about magnesium and curcumin. And curcumin definitely is a, I can say, a Ayurvedic thing. But when we combine all these products into our body, these are natural ones, and when you seek into your kitchen, they are very easily available. So things, when you've got a good clean gut, that's super important nowadays. When you're hydrated well, when you're eating clean, and when you are having a good digestive system, that's where your hormones also start regulating well, and you can see a good amount of skin, good amount of like hair quality. Definitely your menstrual cycles also improve, and you can see your cardio health also improving. So that's where we all need to uplift ourselves to be more wise of what we are consuming, what we are eating, and make sure you're hydrating yourself well with with all these electrolytes. Sometimes we lack and we overhydrate also, and when we overhydrate, that's also where we secrete a lot of potassium, sodium, magnesium from our body. Please don't overdo also that. And that's all. And for anything, any kind of help, or possibly seeking out information, you can just always log you can just log into my there are few channels that I have made on Instagram also by Dr. Samridhi Sharma. You can follow that up, and I have been giving a lot of advice there. though it becomes tough for me to place that much information. But yes, it's super important, so make sure your magnesium is going really well. What is the best magnesium for muscle recovery? Okay, so I think when it comes to magnesium, first of all, get it tested. See how much amount of magnesium you are having in your body. Second is, you can go for some sunflower seeds in your morning bowl where you're having fruits or any other thing. You can just sprinkle a little bit of it, and definitely you can move to more of almonds, or possibly these nuts and seeds, because they are rich in highly in magnesium also, and definitely in omega 3 also, which is also again a very good conversion for magnesium. So make sure you're taking all this, and I hope this much amount of information helps you. So I'm just going to wind up this session, and hope you take this information home and share it with your loved ones. Also, I would like to say, if you have someone as a cardiac person in your home, please make sure you are consulting once while taking any kind of supplements, any magnesium supplements or any multivitamins also, because nowadays there are so many things coming up in the market. So make sure whenever you're consuming something, you are consulting your physician as well, or any kind of trained functional medicine practitioner also. So I will be winding up this session, and I hope this much amount of information helps you. As we've been talking about magnesium and curcumin in this session, you can just go back and look out for the benefits of magnesium, why we need to get this magnesium into our body, and why we need to just make sure that magnesium is playing a part of entire biochemical reactions in your body. Sorry for the disturbance, guys. This is all, and I'll be winding up the session, as I've already collateralated the entire thing. I hope this much information helps. And anyone who's got questions, I can just give 1 or 2 minutes out here so that you can post your questions and I can just answer them. Also, a reminder, people who are going on protein powders, make sure you are not excreting out much of, essential nutrients out there, and consuming protein powder because of protein, because even protein in excess can really lead to damage of kidneys, and that's something that we really need to be aware of. Thank you, guys. I hope there are no questions right now. Sorry for the disruption, guys, because in the moment I have just sometimes, like, my phone also just fall away. For that, I think I'm mistaken. Curcumin for pain management, how does it help? Okay. So, Mona, I think you've been asking a very good question. Curcumin also is an anti-inflammatory. So any kind of inflammation in your body, whether I've seen possibly old people also going, or not old, but definitely even 40 50s have started getting rheumatoid, or possibly osteoporosis, things like these. And all these things start from a point of inflammation. So if you're including curcumin, definitely the pain management starts from there. It's not obviously going to curate the entire disease, but you can prevent certain inflammation in your body, or any kind of infection that has just started. So make sure you are taking care of that. I hope this helps. My main purpose is just to educate people and to make you guys aware of what needs to be done when it comes to your body. I've been talking a lot about gut health, because gut health is something that I've been personally working on. So make sure whenever you're including any kind of supplements or any kind of micro or macronutrients taking from the diet, you are already, possibly including probiotics and prebiotics in your diet also. So this was for all, and thank you, guys, and Fast&Up for bringing me here and this platform. I hope this much amount of information helps you guys. Thank you. Magnesium helps for gut health too. As I mentioned, magnesium is helping your muscles in contraction and relaxation. So just imagine when you are on PMSing, your abdominal muscles are really sore. At that point of time, if you're good in magnesium, you will never have pain, and you will never face the PMSing as severe as to other people. So whenever you're having PMSing really to a severe level, that's where you need to understand you are deficient in magnesium. Thank you, Mona, for questioning. I think this was quite engaging for me. So that's for all. Any other questions if you guys can land up? Is it safe to take curcumin daily? Definitely, curcumin can be taken daily. That's not, there's no harm in that. But if you have any kind of chronic or debilitating, disease, then you need to consult definitely, because not every body is like we say, not every body is allergic to something. So the same way, we all are insensitive to certain food items. So if you're insensitive, then you need to look after it, or any kind of chronic illness or disease if you have, then you need to reconsider it. Any other questions? Okay, guys, so I'll just wind up. Thank you, Fasten Up, and specifically Niti and Jenny, for getting me over this platform. This was quite engaging, and I hope Fasten Up really looks up to you. Guys can just, look up to their coupon codes also. There's a 10% discount over there on Fasten Up, and you can just, I think, use the code FU Runner, 10% off over there, and you can get all the discount out there. Thank you for calling me out, Fasten Up, and I hope this helps.